So if you've been looking for a way to boost your treatment acceptance, this video very well could put you on the path to doing just that. My name is Kevin Johnson, and I'm the CEO of Leverage Consulting, as well as the creator of Leverage U, an online university. So there are 5 things I'm going to share with you in this video on how to boost your treatment acceptance. That said, you might think, well, treatment acceptance is funny because sometimes we throw that term around, and in my world, I feel like it's not just that black and white phrase of treatment acceptance, because treatment acceptance itself could mean more than one thing. And I will clarify that in step number 4 of my 5 things. So the first thing that you have to ask yourself, or the first thing that you have to look at when you're looking to boost your treatment acceptance, is number 1, systems. We have to have systems. And you might think, oh, systems, oh, boring. Well, you have to imagine when you think about your practice, and every practitioner I've ever known, when I say the phrase, less stress, more money, they lean in. They say, tell me more. I want to know more about this. This is why we need systems. Systems are there for 2 main factors. So number 1 is repeatability. And when I say repeatability, imagine if you had to, for example, make a dinner and you had to redo this thing every time, invent it from the beginning. You had to look up the menu, look up the ingredients, go to the grocery store, figure all these things out every time like it's brand new. We don't want treatment acceptance to be like that. We don't want to have to reinvent the wheel every time we present cases to patients. So we want the repeatability not only to make it a streamlined, easy process, and so we can focus on the right things, because the process, we want it to become more like muscle memory as opposed to being the thing that we actually focus on. We want the process to be there in such a way that we just do it without thinking about it, so we can focus on the person who's standing in front of us as opposed to the actual process. Okay? So when you think about the repeatability, the other piece of this is also scalability. So when you think about a practice that is going from 1 million in revenue per year to 2 million per year to 3 million, 4 million, 5 million, and so on, they're able to scale because things become easier. And how do they become easier? Systems. The systems are there because we know if Mandy handled something before us, then I can pick it up. So let's just say if you mapped out that whole treatment coordination process and say there's 15 steps, everything from the front door to them being ushered out the back door, okay? You have to think like Mandy might handle the first 3 steps, and then Judy handles the next 5 steps, and so on. You know, if you're at the 3rd step, these 8 steps were already handled. These 8 steps, things were handled and done in a certain way. Certain things were said to the patient. So we know we can just rely on the fact that certain things were done. Even use this example. If a doctor says to a patient, oh, your insurance will cover that, okay? That's not supposed to happen. That's falling out of the system. And when we do that, it creates more work for the people who work at the front desk, who do treatment coordination, insurance verifications, and all those, and handle the insurance. It creates more work for them. But how about this? On the flip side of things, what if in the back, the patient has had a treatment plan discussed with them, but maybe there's option A and option B. The system is there because the treatment coordinator needs to know there is an option A and there is an option B. And it was the patient leaning one way or the other. That is part of a system. This is why we need it, because if we don't have that, use that last scenario I had, option A and option B treatment options. If we don't convey that information to our treatment coordinator, now they're getting up and running to the back. And what should have taken possibly 5 to 10 minutes is now taking 10 to 20 or more minutes to do, or maybe the patient's frustrated and they leave. And now I have to track them down by phone. And what should have taken 5 to 10 minutes is now taking maybe an hour. Maybe it's taking an hour of the treatment coordinator's time. So this is why systems are super important to boost treatment acceptance. So number 2, scripting. There's another one. Scripting, right? Every time I talk about scripting, I see people staring at their shoes because they don't want to be involved in it. But the funny part is when we are the customer, when we are the consumer, we expect scripting. So for example, if you go to a nice restaurant, not even white linen tablecloth, just maybe your favorite restaurant, and you walk in and right there where they greet you, there's a chalkboard and it says the special of the evening is crab cakes. Okay. I'm from Maryland originally. And when I think of crab cakes, okay, Maryland is the only place to get crab cakes. It is the only place. There, I said it. So when I walk into a place and they have crab cakes on the specials board, I want to know a little bit more about it. Are they using Old Bay seasoning? Are they using JO spice? Where did the crabs come from? Well, that's part of the scripting. And when you go out, when you are dining out, when you are ordering your food, when you are ordering your drink, when you're ordering, let's just say you're ordering a drink, and they say the drink of the evening is a huckleberry old fashioned. One of my wife's favorite drinks to get when she's in Montana. Huckleberry old fashioned. Well, part of the scripting, what kind of bourbon do you use? Well, that's a question that my server should be able to answer. That goes back to scripting, because if they know the answers to those questions, then they are going to increase the likelihood that people are going to be ordering the specials. So when you think about your own practice and you think about scripting, okay, do your team members know where your doctor went to school? Do your team members know where your doctor got their degree? Do your team members know what are the top 3 benefits of this procedure? They need to know those things. I don't care where they work in the practice. They can be a sterilization tech. They should be able to answer that question. They may have started 2 weeks ago. They should be able to answer those kinds of questions. It's not technical. It's just knowledge. It's literally just a knowledge-based type thing. So scripting is there to build knowledge, but it's also consistency for the team. So that's number 2. Number 3 is having a treatment acceptance benchmark. And just having it doesn't really mean a lot. We actually have to measure it. So the third thing is treatment acceptance benchmark. And the benchmark that I use for everyone is 85%. That is a good benchmark to run from. It's something to compare yourself to. And you may wonder, I don't even know what mine is. And that would probably be an indicator that we don't measure it. You should know at the end of every day, at the end of every week, at the end of every month, what is our treatment acceptance rate? And if you're the treatment coordinator, you should know, because it's a measurement of your own efficacy. If you're the doctor, if you're the office manager, you should know that number, because that is a leading indicator of how busy we're going to be in the coming weeks or months. So if your schedule looks a little dry right now, I can pretty much guarantee you that if you focus on treatment acceptance, you're probably going to be filling your schedule. Your producers are going to be busy. So think about treatment acceptance and that benchmark, and make sure that your treatment coordinator is maintaining that number for themselves, because they need to know themselves. Am I being successful or not? But then also the doctor or doctors, office manager, administrator, you need to know, because if you're running this practice and running it like a CEO, you need to know what that treatment acceptance benchmark, or where we are relative to the benchmark, because that's going to be a pretty clear indicator of how busy we're going to be in the next couple of days, weeks, and months. So that was number 3. It's also, so number 4, this gets back to what I said in the beginning of the video about treatment acceptance is not just that, may not be what you think it is. So treatment acceptance, in a sense, can be measured in 2 ways. And here's my example. So if you met someone and they said, my treatment acceptance rate is 100%, sounds pretty good, right? What if that was one case? What if it was just one case? That sounds fantastic, right? What if it was only 10? What if they saw 10 cases in that time period and they had a 100% acceptance rate? Fantastic. But it's really not, because one of the things you need to also think about is treatment acceptance can be based off of a percentage of dollars, or it can be based off of a number of units. So it doesn't matter if you are presenting orthodontic treatment, let's just say clear aligners. If you're presenting large cases like implant supported dentures, if you're doing smaller cases, it could be as simple as a crown. no matter what it is that you're tracking, you have to think about whether we're actually tracking, not only tracking the percentage, because it might be overinflated. So imagine if it was just the one case. We had one full arch case. Fantastic. You got one. And it's a big deal because it's a big case. But if you're comparing that 85%, because one of the clients that I've worked with historically, when we sat down and measured their practice and their treatment acceptance rate, it was as little as 43% for a period of time. But it's because they had a conversation with every patient that came through their chair who was an eligible candidate. They had that conversation with every patient that came through their practice. So their percentage was really low, but their chairs were really full. So you have to really think about looking at both, because you're not only looking for a high percentage rate, but I want to know how many units I'm actually converting or how many patients. So when I say units, it could be the actual treatment that you're proposing and providing, or it could be the number of patients. But you need to sometimes look at both, not always, but sometimes you need to look at both, because if you're looking to grow, let's just say your implant practice, if you're looking to grow that, okay, if you have a 43% acceptance rate, but you have 1,000 units that you're placing every year, I'll take the 43% because I'm placing 1,000 implant units per year. That's pretty fantastic. But if your acceptance rate is really high, but we're not doing a lot of units, it's time to start having more conversations. And in that instance, I'd be more accepting of a lower treatment acceptance rate if we're having a lot of conversations. So some of the first four things that I talked to you about, they're a little bit harder, a little more tangible. This last one is a little squishy, but it's probably has the highest impact. And that is, how do you make your patients feel? And when I talk about how you make them feel, you can do everything right. You can have a fantastic treatment presentation. You could teach them how to be a doctor, a dentist, okay? But if they don't feel good at the end of the consultation or the new patient appointment, you've decreased the likelihood that they're going to say yes. Because this whole thing, this whole video, this whole treatment acceptance idea for your practice is about one word: yes. That's all you're looking for. So everything you do has to be geared towards yes. And we can get in the weeds with details and everything else of everything that we've talked about. There are some treatment presentations that are very lengthy and very informative, and they could be a little on the boring side, okay? We need to make sure that we're speaking to the person who's sitting in our chair. And when we know who's sitting in our chair, we can talk to them. And most times I could say most treatment presentations could be boiled down to less than a 5-minute conversation, maybe 10 minutes, depending on what the procedure is. No more than 5 to 10 minutes. And then all the rest of the time is there to make them, to influence how they feel. And we also have to remember, it's not just about the doctor. So I have this entire module that I either teach on site for clients, or I also have a module that I've built out in Leverage U that's all about the treatment presentation process. And the one thing that's always an aha, a huge aha for the entire team is, and I'm going to let you in on a little secret, it's not all about the doctor. No, it's not all about the doctor. In fact, the doctor's presentation could be rushed. It could be hurried. It could not be their A game, because maybe they're running late from another one. Maybe something happened. They got a ticket on the way to work. They're not in a very good mood. Well, for whatever reason, it may not be their A game. But in that instance, the team could make up for that. And the team, you also have to remember, the team is doing a lot to set the doctor up for success. So when you think about this, the treatment acceptance rate and how you make that patient feel, it starts at the first phone call and follows its way all the way to the first doctor interaction or provider interaction. And then it follows through on out to the treatment coordinator. That entire process, which again is mapped out in a 15-point process that I've got in either an on-site presentation and also in our Leverage University, it's all mapped out. And it's amazing how little impact or how little time the doctor has compared to the rest of the team. So there's your 5 ways to impact your treatment acceptance rate. Again, my name is Kevin Johnson. I'm the creator of Leverage U, as well as the CEO of Leverage Consulting. If you like content like this, hit the like, hit the subscribe, hit the notification. Go back and listen to my other videos because they're really good too. Otherwise, I'll see you in the next video.